Mavenclad is a prescription medicine used to treat relapsing forms of multiple sclerosis, MS, to include relapsing-remitting disease and active secondary progressive disease in adults. Because of its safety profile, Mavenclad is generally used in people who have tried another MS medicine that they could not tolerate or that has not worked well enough. Mavenclad is not recommended for use in people with clinically isolated syndrome, CIS. Mavenclad may cause serious side effects. Treatment with Mavenclad may increase your risk of developing cancer. You should follow healthcare provider instructions about screening for cancer. Because of the risk of birth defects, do not take Mavenclad if you are pregnant or of childbearing potential and not using effective birth control. Please see important safety information at the end of this video and full prescribing information medication guide, including serious side effects.
I realized during gym class that something was really wrong when I felt some numbness in my arm. I wasn't able to do all the things that my friends were doing. I wasn't really able to play sports just because I'm feeling really weak, to the point where it looked like I wasn't even trying, even though I was trying my hardest. My name is Sagal, and I live in Milwaukee, Wisconsin. I'm 25 years old, and I'm a student studying urban planning. I also work at a civil engineering firm. Some of the first symptoms were headaches and fatigue and having some numbness in my arm and in my leg. I would go to doctors and they would just say, maybe it has something to do with like your period. It could be depression. And it was just very frustrating because I don't really feel depressed. I just feel physical symptoms that are really holding me back. I woke up one morning and I had to go to work. I had a really bad headache. I just took my medicine and I went off to work. And when I got to work, it got much worse. The next morning, I had to end up going to the ER. The doctor was pretty dismissive. My dad is a physician and works at that hospital. He just went off and found another doctor to take me in. And that doctor did a lot of tests, a lot of blood work, asked me if I had traveled anywhere, if I ate anything, CT scan, MRI. They did a spinal tap, which confirmed everything. And they had a neurologist come, and the neurologist told me that I have MS. I felt, on one hand, relieved that I was not crazy and I wasn't being too sensitive. I also felt a lot of dread, like, I don't know what MS is. I don't know what's gonna happen. I just felt like my life is over. Like, how am I gonna go to college? How am I gonna get married? How am I gonna have kids? How am I just gonna do regular things that I wanna do? I limited my stress and tried to kind of give myself a schedule where I wasn't kind of just going to school, going to work, doing all these activities, and also exercise just to kind of maintain what strength I do have. Like, if I know I have guests coming over to my house and I'm preparing everything and cleaning, cooking, I know the next day I'm gonna have to take a break. My response from my friends and family was pretty good. I mean, they were very supportive and they were, of course, very scared and worried.
My name is Bhupendra Khatri. I'm a neurologist in Milwaukee at the Center for Neurological Disorders. I specialize in multiple sclerosis. I put Sagal on an oral treatment option that she had to take every day, and she became well enough to attend college on a limited basis and was able to work part-time.
He had been seeing me regularly throughout the years, and during that time, my symptoms had gotten worse. I was experiencing more headaches, more fatigue, more numbness and tingling. It was a lot. It had gone all the way up. I didn't even feel like myself. And when I had went to Dr. Khatri for my regular checkup, he had noticed changes in my tests.
A new MRI confirmed some progression of the disease, and she had to put her college studies and work on pause. I told her about Mavenclad, cladribine tablets, which had come on the market in 2019. I had been following the development of Mavenclad for years. I felt that Sagal was an excellent candidate for this short course oral therapy. Mavenclad is indicated for the treatment of relapsing forms of multiple sclerosis. Because of its safety profile, Mavenclad is generally used in people who have tried another MS medicine that they could not tolerate or that has not worked well enough. Mavenclad is not recommended for use in people with clinically isolated syndrome, also known as CIS.
The process that Dr. Kachur kind of put me through, he just asked me some questions on, how I was feeling and things like that, and going over Mavenclad and the risks and the benefits and kind of how the medication works.
At the same time, I reminded them that, look, on one hand, we need to look at what are the risks of not treating MS. And the risk of not treating MS with an efficacious drug is that the disease will progress. I made sure that Sagal and her family were aware of potential side effects. I explained that there is a cancer risk associated with the medication, and she needed to follow screening guidelines. I also noted that there is a risk of birth defects for pregnant women, and that men and women of childbearing age should use effective birth control during treatment and for at least 6 months after the last dose of each treatment course. The most common side effects of Mavenclad include upper respiratory infection, headache, and low white blood cell counts. Mavenclad is the only short-course oral therapy that requires a maximum of 10 treatment days a year over 2 years. Patients take 1 to 2 tablets for up to 5 days per month for 2 consecutive months during the first year, and then repeat the course at the beginning of the second year. Patients will continue to be monitored throughout the course of Mavenclad treatment and at least for another 2 years, in which you do not need to take Mavenclad. During the 96-week clinical trial for Mavenclad, patients who took the medication experienced a 58% reduction in relapse rates per year compared to those who took a placebo. Mavenclad is believed to work by reducing the number of T and B cells in the body, so there are fewer of them to attack the nerves. Low blood cell counts can increase your risk of infections during your treatment with Mavenclad. Once treatment is finished for the year, the immune system will begin to produce new T and B cells. It may take several months or more for the recovery of the T and B cells, but some patients may not go back to pre-treatment levels. Sagal, how are you doing? You're looking great. How do you feel? We discussed about what this drug would mean for Sagal. And I think she liked the idea that, one, this is a drug where she does not have to take on a daily basis like what she was doing before, and also the efficacy of the drug.
The dosing with Mavenclad is a lot better for me because I'm not having to worry about going in for an injection, and I like it a lot more.
I think right now, Sagal is doing very well. She has a very positive outlook on life. She's working out, she's attending college. She can accomplish her goals that she has set out to.
I would tell people that were recently diagnosed with MS that, life continues, and although it seems like, this is something that is a huge kind of obstacle or block, that there are a lot of great doctors and nurses and other healthcare professionals out there that are willing to help you.
Mavenclad cladribine tablets, important safety information. What is Mavenclad? Mavenclad is a prescription medicine used to treat relapsing forms of multiple sclerosis, MS, to include relapsing-remitting disease and active secondary progressive disease in adults. Because of its safety profile, Mavenclad is generally used in people who have tried another MS medicine that they could not tolerate or that has not worked well enough. Mavenclad is not recommended for use in people with clinically isolated syndrome, CIS. It is not known if Mavenclad is safe and effective in children under 18 years of age. Mavenclad may cause serious side effects, including risk of cancer, malignancies. You should follow healthcare provider instructions about screening for cancer. Mavenclad may cause birth defects if used during pregnancy. Females must not be pregnant when they start treatment with Mavenclad or become pregnant during Mavenclad dosing and within 6 months after the last dose of each yearly treatment course. You should stop treatment with Mavenclad and contact your healthcare provider right away if you become pregnant during treatment with Mavenclad. For females who are able to become pregnant, Your healthcare provider should order a pregnancy test before you begin your first and second yearly treatment course of Mavenclad to make sure that you are not pregnant. Use effective birth control, contraception, on the days on which you take Mavenclad and for at least 6 months after the last dose of each yearly treatment course. Talk to your healthcare provider if you use oral contraceptives, the pill. You should use a second method of birth control on the days on which you take Mavenclad and for at least 4 weeks after your last dose of each yearly treatment course. For males with female partners who are able to become pregnant, use effective birth control, contraception, during the days on which you take Mavenclad and for at least 6 months after the last dose of each yearly treatment course. Do not take Mavenclad if you have cancer, malignancy, are pregnant, plan to become pregnant, or are a woman of childbearing age or a man able to father a child and you are not using birth control. Are breastfeeding. Are human immunodeficiency virus, HIV, positive. Have active infections, including tuberculosis, TB, hepatitis B or C. Are allergic to cladribine. Before you take Mavenclad, tell your healthcare provider about all of your medical conditions, including if you think you have an infection, have taken, take, or plan to take medicines that affect your immune system or blood cells, or other treatments for MS. Certain medicines can increase your risk of getting an infection. Have had a recent vaccination or are scheduled to receive any vaccinations. You should not receive live or live attenuated vaccines within the 4 to 6 weeks preceding treatment with Mavenclad, or receive these types of vaccines during your treatment with Mavenclad and unless directed by your healthcare provider. Have heart failure. Have or have had cancer. Have liver or kidney problems. Are breastfeeding or plan to breastfeed. It is not known if Mavenclad passes into your breast milk. Do not breastfeed on the days on which you take Mavenclad and for 10 days after the last dose. How should I take Mavenclad? Mavenclad is given as 2 yearly treatment courses. Each yearly treatment course consists of 2 treatment weeks, also called cycles, that will be about a month apart. Take Mavenclad with water and swallow whole without chewing. Mavenclad can be taken with or without food. Swallow Mavenclad right away after opening the blister pack. Your hands must be dry when handling Mavenclad and washed well with water afterwards. Limit contact with your skin. Avoid touching your nose, eyes, and other parts of the body. If you get Mavenclad on your skin or on any surface, wash it right away with water. Take Mavenclad at least 3 hours apart from other medicines taken by mouth during the 4 to 5 day Mavenclad treatment week. If you miss a dose, take it as soon as you remember on the same day. If the whole day passes before you remember, take your missed dose the next day. Do not take 2 doses at the same time. Instead, you will extend the number of days in that treatment week. Your healthcare provider will continue to monitor your health during the 2 yearly treatment courses and for at least another 2 years during which you do not need to take Mavenclad. It is not known if Mavenclad is safe and effective in people who restart Mavenclad treatment more than 2 years after completing 2 yearly treatment courses. Mavenclad can cause serious side effects. If you have any of these symptoms listed below, call your healthcare provider right away. Low blood cell counts have happened and can increase your risk of infections during treatment with Mavenclad. Blood tests are needed before you start treatment with Mavenclad, during your treatment with Mavenclad, and afterward as needed. Serious infections such as TB, hepatitis B or C, and shingles, herpes zoster. Fatal cases of TB and hepatitis have happened with cladribine during clinical studies. Tell your healthcare provider right away if you get any symptoms of the following infection-related problems, or if any of the symptoms get worse, including fever, aching painful muscles, headache, feeling of being generally unwell, loss of appetite, burning, tingling, numbness, or itchiness of the skin in the affected area, skin blotches, blistered rash, or severe pain. Progressive multifocal leukoencephalopathy, PML. PML is a rare brain infection that usually leads to death or severe disability. Although PML has not been seen in MS patients taking Mavenclad, it may happen in people with weakened immune systems. Tell your healthcare provider right away if you have any new or worsening neurologic signs or symptoms. These may include weakness on one side of your body, loss of coordination in your arms and legs, decreased strength, problems with balance, changes in your vision, changes in your thinking or memory, confusion, or changes in your personality. Liver problems. Blood tests should be performed to check your liver before you start taking Mavenclad. Symptoms of liver problems may include nausea, vomiting, stomach pain, tiredness, loss of appetite, dark urine, or your skin or the whites of your eyes turn yellow. Allergic reactions, hypersensitivities. You should stop treatment and seek immediate medical attention if any signs or symptoms of allergic reactions occur. Symptoms of an allergic reaction may include skin rash, swelling or itching of the face, lips, tongue, or throat, or trouble breathing. Heart failure. Mavenclad may cause heart failure, which means your heart may not pump as well as it should. Call your healthcare provider or go to the closest emergency room for medical help right away if you have any signs or symptoms such as shortness of breath, a fast or irregular heartbeat, or unusual swelling in your body. The most common side effects of Mavenclad include upper respiratory infection, headache, and low white blood cell counts. These are not all the possible side effects of Mavenclad. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. Please see full prescribing information medication guide, including serious side effects, for additional important safety information.